Good evening, everybody. Welcome on in to my podcast, Medical Talk in Layman's Terms with Nurse Charlene. And I am the host, Nurse Charlene. And yeah, it's me, y'all. It's me. Everybody starting to make it a household name and stuff. And I appreciate that. But yes, it's me on here pushing forward and stuff. So welcome on to another installment where we're going to be talking about why do I got to go to the doctor's office and stuff. So we're going to be talking about doctor's appointments, history and physicals, screenings, emergency room visits, lab work, and vaccines. Not in that total order, but a little bit. We're going to touch on a little bit of all those things and everything so that people know why I got to go to the doctor. I'm sick of doctors and stuff. They always want you to come in there and then they make you wait heck long and stuff. Well, they do. But yeah, don't you want to find out sooner than later and stuff? So let me go ahead and get everything started. So welcome on as y'all come on in and stuff. I'm going to go straight to my podcast disclaimer in just a minute and put a couple people on just a second. Oh. Let's see. Oh, yeah. You know what? I found out that I don't know how she did it, but my mama blocked me. Blocked me on Facebook and stuff. And I had to go in and unblock me. I was like, wait, how do you figure out how to do that anyway? But anyway, that's a part of life and stuff. You know, everybody be trying to get savvy. And that girl didn't block me. Don't be blocking your daughter. No, I'm just playing and stuff. But you guys, welcome on. Hey, Miss Sandra. Welcome on, Sandra and T. She said, good evening, Nurse Charlene, Rosie, and little Brittany and stuff. They'll be on pretty soon. I just put Rosie Granny Allen on. That's my mother. She come on faithfully. She's my toughest patient ever. And she's made me the doctor that I should be. Pretty soon and everything. Oh, welcome on, Auntie Josie and stuff. Welcome on in and stuff. I know that I think you were out of town. You might still be and stuff. But she said, hello, everyone. Hope everybody's having a blessed evening. And we all hope you're having a blessed evening. And thank you and welcome on. Thank you for coming on, you guys. And I appreciate you definitely. And stuff. I'm trying to find out why I can't get on and stuff. I'm trying to put myself on so I can see and everything. Oh, okay, there you go. Better had. Okay, you see how? Oh my goodness. Oh yeah, I like that when it talks to you and stuff. But anyway, now that I'm done smiling and just in love with all that activity. Oh, you just got back today. Auntie Josie just got back from Vegas on a basketball tournament for her grandson and everything. Shout out to him. I know he did good. He was balling. I know he a baller and everything. But yes, definitely. So welcome on in, you guys. And yeah, we're going to get started. We got a good podcast. One more thing before I read my podcast disclaimer and stuff, looking at the back end, I got the little chart, for chart review with the little heart and stuff saying, with the EKG signs. We got an eye chart, how they tell you to take your hand and put it over your eye and say the letters and stuff like that. I made up my own, I'm Picasso anyway and stuff. So I made up that, and then that's a little clipboard. Everybody don't know about that, but I do and stuff. But a lot of people do know about it, having a clipboard. And there's a few other little items and stuff. And then what we're talking about, the topic, and that's all the different things like doctor's appointments, history and physical, annual screenings, the emergency room, that's ER visits, emergency room visits, lab work. They always trying to shoot me up with something, and give me a vaccine and stuff. Forget them, or whatever and stuff. But yeah. Have you ever thought that they're a human being with their own mother, father, sister, brother, cousin, uncle, auntie, and all of that stuff. So what makes them even care about you? Because they went in a line of doing that, helping people and helping you help yourself, and everything. So the doctors, they're there to help, uh, garner this cure for you, for this or that and stuff to give you a better possible quality of life if you behave, and even me, it wasn't like I like to go to the doctor. I didn't even know what a doctor was for a long time until I started going to school and doing my thing and learning about being a caregiver, a person that provides care to somebody and everything. And then that's how my little story, went along. And yeah, it's crazy, but wait till you hear. I don't want to get into it ahead of time and everything, but wait till you hear what I got to say, because it sounds like it might be boring. As last week I talked about STIs, STDs, or sexually transmitted infections or disease, whatever one you want to go with and everything. And I know that was a little spicy. I said it was going to be spicy, but this one is spicy too. And you'll find out in just a moment. So let me go ahead and get on in. So we got, welcome to Medical Talk in Layman's Terms with Nurse Charlene, where health and illness are broken down into simple, easy to understand conversations. This podcast is for educational and informational purposes only. While me, the host, Nurse Charlene, is a licensed registered nurse with extensive healthcare experience, the information shared here is not intended to replace professional medical advice, diagnosis, or treatment. I'm just enlightening you. Every person is different. What works for one individual may not be right for another. Always consult your doctor, nurse practitioner, or qualified health care provider with any questions you may have regarding a medical condition or before making changes to your health, medications, or lifestyle. Before you make the changes, at least consult with them. They've known you hopefully for a little while now. If you think you may be having a medical emergency, call 911. Just like they say on the doctor, you call the doctor. And it says, if this is a life-threatening emergency, hang up and call 911. Okay, that's what that meant and stuff. Or seek immediate medical attention. The views shared on this podcast are based on professional experience and general medical knowledge, presented in layman's terms to help bridge the gap between healthcare and everyday understanding. By listening to this podcast, you acknowledge and agree that this is not a substitute for personalized medical care. No provider-patient relationship is established, and you are responsible for your own healthcare decisions. Remember, your body speaks. Your body is a snitch. Believe it. Listen to it. Respect it. And when in doubt, check it out with a medical professional. Thank you for tuning in and taking a step towards better understanding of your health. Thank you, guys. Welcome on in. All right. So I said that the topic is just so many, because I don't know if you could see this up here and stuff, but it's a lot of them. And it's, it says doctor's appointments, history and physicals. It was no way to get all of that in so that you guys know what I'm talking about. I do these certain podcasts where I talk about CPR versus first aid, that they are not the same. CPR is that actual thing where they get on top of you and start, your heart stops and they feel for it and you can't feel anything, no pulse, no breathing or something like that. And then you get on and start doing CPR. That's one thing. That's to revive you or to try to get that CPR. Every push is trying to get you to mimic a heartbeat, that your heart should be beating, but it's not because of something that's wrong. Something went wrong and stuff. Whereas first aid is like, how to recover from a bee sting, how to recover from breaking your ankle or cutting yourself, or some type of injury or something. And it's different. They're the same. They're both life-saving, but they're different items. They do different things. CPR is to resuscitate you, whereas first aid is to fix a problem. I cut my finger. I fell and scrubbed up my knee. I have a rash, I have this, or something like that. I got into poison ivy, or something like that. And then that's for that, which you wouldn't do CPR on a poison ivy person or somebody that needed a Band-Aid, or something like that. So if that makes sense, that's what I'm trying to get at and everything. So the introduction, okay. Healthcare visits can save lives when problems are found early. Many people avoid doctor's appointments because of fear, false evidence appearing real. Cost. I don't want to pay them. They're going to send me home with a hospital thing. I don't want to pay no copay or whatever. Cost. Stress. Oh, if I go there and then I got to sit and then they take everybody before me in the back. I'm just saying. Denial. I'm not even sick. I'm not that sick. I'll never get sick anyway. So I don't know what this is and stuff, but it'll go away. I'll just take some Tylenol. I heard that was the cure for everything. Okay. Or simply not understanding why they are important, which is doctor's appointments. But your body often gives warning signs long before a serious illness becomes an emergency. So the whole thing is, you guys know that my LLC is called Your Body is a Snitch, Believe It. And so, what your body is. That's your body that you're in. And then it's a snitch. A snitch is like a tattletale, not snitches get stitches, that one, but snitching on you. And how does it snitch? It snitches in the form of a symptom. A symptom is a headache, a fever, swelling, redness, a rash, a headache, what else? Back pain, ankle pain, knee pain, any type of thing. Throwing up, that's a symptom, that's something that's happening. Vomiting, being nauseous, and not vomiting, but being nauseous. Constipation, diarrhea. Those are all symptoms of something. Something's happening. Maybe you're vomiting because you had food poisoning, but we don't know that. We wasn't with you. We didn't know what restaurant you ate at. So you see, the snitch is your body is saying, hey, something wrong. So I'm gonna have your stomach upset. I'm gonna give you the bubble guts. I'm gonna give you diarrhea. I'm gonna stop it up and nothing gonna come out. I'm gonna block it, or whatever it does and stuff. That's it snitching. When you don't listen, or okay, it's diarrhea, so I'll take some Imodium and I'll stop the diarrhea. Why did you have diarrhea? You a doctor, right? No, you're not a doctor. So why did you have it in the first place? It might be something that you eating off the, and it got some E. coli in it, and now you got the bubble guts and you pooping water. Or something like that. So everything has a reason. We choose to mask it. I did it for years and years until I start understanding the body and diving deep into this. And over time, I found myself thinking and sitting there and just wondering, why is this and why is that, and coming home with questions, that I didn't even ask the doctors, and all of them around, they're willing to tell me even more than they would tell the patient. They'll tell the nurses and stuff. So the whole point of it is, if your body is saying something, why not find out first? And then you can have all the Pepto-Bismol, Alka-Seltzer, Imodium, Kaopectate, IV fluid, antibiotics. You can have everything you want, but find out why. You don't have like you weren't diagnosed with an ear infection. So you gave some Tylenol, the baby stopped crying. You got some Tylenol, you stopped crying. Your ear was still hurting and everything. So why was it hurting in the first place for you to take the Tylenol? You got to get that answered first, and then you can have all the Tylenol you want, but at least find out why is it hurting. Because it might just be an infection. Guess what? If you just cover it up with Tylenol, it might go away or calm down for a minute, but guess what? It's in there churning and cooking up some stuff. Next thing you know, you got pus coming out your ear. Your eardrum is blown, and now you're hard of hearing in that one ear because you didn't go, like, Tylenol didn't cure it. It stopped the pain, and stuff. It might have stopped the fever too. So it stopped another symptom, another snitch, and everything. So that's what I'm talking about when I'm saying this stuff. It's not just a catchy phrase or something cute, Charlene then came up with and stuff. It's actually some real science to it and everything. Welcome on in, Rosie Granny Allen. She says she's watching in Jesus' name. And take your time and teach, Nurse. Real talk. Thank you, Ma. I will take my time and teach. But do y'all hear my plea, and stuff? It's not a mean thing, and stuff. It's me really talking to you like we really got to start finding out what's wrong with us and stop taking these microwave solutions. Oh, I had some antibiotics before when my butt was itching and stuff. So I'm going to just take them. She said it might be that nurse on that podcast said it might be an ear infection and stuff, but I got some antibiotics and stuff. It don't matter what kind and stuff. Yeah, it do matter. It might have been for just that butt itch and stuff, and it might not be for this one, and stuff. So you want it fixed. You want to know why it happened in the first place, so that you could correct whatever that happened, and stuff. And even if you can't correct it, at least you get to fix the right thing. So you're taking a medicine and it's not in vain and everything. So just remember, you can't be your own doctor if there's doctors out there. You could be your own doctor. Well, you know what? The doctors can't be their own doctor. They got to go see a doctor too. So they got to put down their pride, and they put down their hat, and then they got to get a prostate exam, or a woman got to get a pap smear, doctor and stuff. They got to put down their, all their pride, and they got to go in and see a practitioner or something to fix what's wrong with them. They might could tell them ahead of time because they know that more information is good information, and everything. So that's where that comes from. So we're going to be talking about first doctor's appointments. Why I gotta go to the doctor? I hate the doctor. They make you stay in there like 100 years in the waiting room, and everybody seems like they go before you and all of that stuff. Yeah, I know. Guess who complained? Bam! Yep. I was she here before me? Where my doctor at? Why he ain't never on time? Why she ain't never on time? All the other ones is going in there and stuff, but they seeing different doctors possibly. Or they might not be getting what you getting where you go inside the room with the doctor. Or the doctor then got in there and faked around and found out somebody actually started snitching on their body because their body was snitching on them. And so they in there a little bit longer than they should be. And so then they can't get on down with you. So you got to wait. They cleaned the room already. They just waiting to see if they could call you back there. And they see you impatient, so they might leave you out there a little bit longer, truth be told, and everything. So a doctor's appointment is a scheduled visit with a healthcare provider to prevent illness, diagnose a problem, monitor chronic diseases. That means long-term diseases. You already had this. You had diabetes. You had high blood pressure, and it's been for a while now and stuff like that. So they're monitoring it, treating symptoms. Yeah, I got a new one now. I didn't have a headache every single day, all day long. Nothing I take helps, and they're there for that and everything. They order tests. I need you to go to Quest Diagnostic or so-and-so, labs and get your blood drawn, or they might have a blood drawer inside the office, depending on how big it is and stuff like that. Or they send you out for tests. We don't know what it is. So that's why they test you for different things. It's not just blood. Sometimes it's urine. Sometimes it's an ultrasound or an MRI or a CT scan. It's just different things when you go to the doctor's office. Also, they may want to, you want your flu shot, you want your so-and-so. Every time I take the flu shot, I get the flu. No, you already had it. I know it sounds like that. Yeah, they can't afford that. If they give everybody the flu by giving them the flu shot, you just sensitive to it. You might have an underlying condition that you don't even know about because you don't tell your doctor enough. And that might be the reason why you might feel like you're allergic. Or you might really have something that makes you not a candidate for vaccines. And there's real things like it's one, I'm not going to explain it all, but it's Guillain-Barré disease. It's a real disease. And I've known several people with this over my past 22 years and everything. So with that being said, sometimes people can't take vaccines and they're highly allergic, and, it does the opposite. The wrong vaccine can put them in a hospital. So there is times like that and everything, but it's not everybody. The government trying to put nanopods in me, and yes, they don't have money like that to do that. That's why we're in a deficit and all of that. Yeah. But anyway, before I get all caught up, I'm just saying vaccines, and then they educate you like I'm doing now. I'm just bridging the gap. And my doctor actually is one that told me. I have a nurse practitioner, which is a registered nurse with extra training, so that they're so good that they become almost a doctor, and everything. They're my nurse practitioner. That is my doctor, and I recognize her as a doctor. And she's been there long enough that she is my doctor, and she is a doctor, and she's very good and excellent at checking out things. She know her patients. She reads them. She looks dead into their eyes and talks to them, asks a few questions. Those questions help her determine what she wants to do with you and everything and stuff like that. So it's the real deal and everything. What else? Doctor's appointments are not only for sick people. Healthy people need a routine care also before you get sick, because everybody could get it, and everything. So there's a type of doctor visits. One is called a routine checkup. And routine means the same old same. And it's a checkup, meaning they checking in and stuff. And this is what they want to do. It's a yearly wellness visit, a routine checkup to evaluate your overall health, whether you have some or not and stuff. It doesn't matter. It's just a routine checkup. And the examples of that is checking your blood pressure. If it was high before, but they weren't ready to put you or just a little bit high, they want to see if it came down or is it worse, and everything, because now you might have to graduate to taking high blood pressure medication and everything. So that's where that comes in at. Also a weight check, weight gain or loss, because sometimes if you have a huge weight loss, and it's not because of something that you had done or a certain medicine you're on and stuff, then that can mean that something else is going on. And I'll just leave it at that. I don't want to complicate it too much and stuff, but that's why they do a weight check. Are you overweight? Are you underweight? Are you right in the middle? You hanging out, and stuff at a normal weight and everything. Then you got your medication review. Do you still take that medicine for so-and-so? Do you still take that cream for this and that? Do you still take, and stuff, that baby aspirin every day? Yep, I take that and stuff. Do you take that blood pressure medicine that I put you on? It's once daily and stuff. Do you still take that? And so, yeah, I take it. Well, you got some headaches and stuff. You've been having them every day. and you've been taking that, because I might have to increase the dosage. This is the doctor saying, I might have to increase the dosage. Nah, I lied. I wasn't taking it. I hate taking pills. I be forgetting and stuff, so I don't take the pills. This the patient. So how do they fix that blood pressure? Now your blood pressure then super saiyaned on you and stuff, and it then leveled up, and now you got full right on high blood pressure, and stuff. First it was borderline. They gave you a little tablet, and you stay on it for a little while, and you change your lifestyle a little bit and eat less fried foods and different things, exercise every day and stuff, and you'll be okay. Yep, I'm not exercising. I said I was exercising. I was going to exercise. Yeah, I'm not exercising. I don't drink water. Water is nasty. It tastes like water. It don't have no flavor. I like fried food, and I like cake and ice cream, preferably on my cake or in my cake and stuff. And then, yeah, you see what you're doing, right? Because sugar is okay. Your cells need sugar for you to function. Eating one slice is probably okay. Eating one slice per meal, you're pushing it. Eating the whole cake and not giving nobody else none because you're afraid somebody else gonna try to eat up your cake, and you eat the whole cake, you probably just you asking for that diabetes. You asking to be what my daughter called diabetical and stuff. You're looking for it and everything. So that's what we're trying to do. So we're doing the doctor is doing preventative checkups. That's what your routine checkup. So checking your blood pressure, checking your weight, checking over your medications. Are you taking them for real? Don't lie. Just say you're not taking them. And they're gonna increase it. And now you got high blood pressure. You just add you an extra little diagnosis and everything. Do you get the vaccine? No, because if you give me the COVID one, it hurts so bad. I know that it gave me COVID again. Yeah, they can't afford you. You and everybody else that they give a COVID, they can't afford it. They barely can afford to give you health care. They try to cut all of that out and stuff so that nobody wants to pay for it, and everything. And the people making the decisions, they don't even care what you look like if you live or die. They're making decisions on what they want to do and what their money look like in their district or whatever and stuff. So yeah, they don't care about you. You're not that important. I'm not that important. Okay. So that is routine checkups. There's another type of doctor visit that they have. It's called a follow-up visit. And this is a visit after what? After you didn't had surgery. They want to check up on you. So it's a routine follow-up visit now. You went to the hospital. You ate something, it was bad, you got food poisoning, you was vomiting, they gave you some IV fluid and pumped your stomach or something and sent you home or something like that. Now the doctor wants to see you in the doctor's office to see, is you good? Or do I need to give you something else too? You still throwing up, or whatever and stuff. So that's where that comes in at. So surgery, hospitalization, after lab tests, you go to the routine checkup, they order labs. I'm gonna get you, I need you to go to the diagnostic place and get you get this blood drawn. They're gonna take about 4 tubes or whatever and stuff. They might not even tell you that, but I'm just saying, you see them take 4 tubes. You want to probably know if you any at all interested in living, you probably should try to find out what the blood was for, because they're checking something and they know what it's for because they're going to get the results back. But you need to be checking too, so you can find out, is that something that I need to know, that my potassium is too low, my magnesium too low, my so-and-so, because low potassium or magnesium can stop your heart. Too high over the limit of potassium or magnesium can stop your heart. And guess what? If your heart is not beating, what happened? Yeah, you on the stairways to heaven, or maybe the stairways to hell, the elevator to hell, but you're gonna be on one of them stairways, and stuff. So it's really important. and everything. So that type of stuff. So lab visits, and this is the follow-up visit. So surgery, recent hospitalization, lab tests to read them back to you, and hopefully you'll have questions for them on why did they order this, that, or the other. On starting the medication, they start you on a medication at your routine checkup, and now they want to see, has it been working? No, my ear fell off and my eye popped out of the socket and stuff. And I here it go. Could you put it back in for me? Or something like that. Or I'm just being sarcastic, but I'm just saying they might have started you on a medication. And then also is chronic illness monitoring. Okay, you got diabetes and had it for 15, 20 years now and everything. So it's chronic. It's a long time. Acute means, it just happened. Chronic means over time, a long time you had this or that. It doesn't matter what it is. It's just chronic. And so they monitor and they keep following up. An example of that would be a diabetic patient returning to check on a blood sugar to see if, now that they got their little machine, have they been checking it, the 3-4 times a day or something like that. But not only that, but is it improving with the medicine that was given and the new diet, trying out that, and everything. So it's a reason behind it. Okay. And then we got another type of doctor visit. It's called a sick visit, a visit for symptoms or an illness. A sick visit is, I've been vomiting for 3 days. I've had diarrhea for 3 or 4 days in a row. What is it? I don't never have diarrhea, or I haven't been able to poop for 3 days. This is the 4th day, or something like that. And so why? And that's one of those why visits. And an example of a sick visit would be because you had a fever. Yeah, it was 102.9 kBL. No. But anyway, it was 102, 101 or something like that. That's a fever. That's an honest fever. 98.0 is the normal. 97 something is a normal one. 101, yeah, you pushing it. 99, you already going into one. So it's going to either go up or down and everything. So that's one of the reasons why you will come in for a sick visit. You got a fever. You got a cough. You got a rash. You got some pain. It was some pain that just popped up. My ankle is hurting. My knee is hurting. My hip is hurting. Okay. And stuff. Granny Rosie said, say that. That's right. And stuff. This is some real stuff. I'm telling you, I'm going to make you the master of your own destiny in a minute, and everything. No, the man upstairs controls it all. But I'm saying you'll be doing yourself a favor by knowing something too. And then vomiting. That's a sick patient visit. I've been throwing up. I'm coming in with a bag because I don't know if I'm gonna throw up again. I threw up in the car coming here, and stuff. So that's a big deal. And then there's also a visit or a doctor's appointment called a specialist visit. And this is a visit with a doctor who focuses on one specific thing, one set thing. So if they sent you to a specialist, that would be like a cardiologist. So cardio is your heart. An ologist is the study of your heart. So a cardiologist is your heart doctor. A neurologist, that's your nerves and the study of the nerves. And that would be your brain and nerves doctor and stuff. That's your central nervous system. So that's your brain, your spinal cord, and you got nerves all over, nerve endings all over, behind your eyes, everything. Everybody got a nerve everywhere, all over their body. And then you got oncologists. So onc or onco means cancer and the study of cancer. So it will be an oncologist, and that will be a cancer specialist, somebody who deals with cancer and diagnosis and suspicion of it. Even if it's not cancer, if you're sent out and stuff, it might be something that you might want to pay attention to. Why are you going here? Because it could be something cancer-like, but not quite cancer. and everything. And then you got your orthopedic doctor. Orthopedic is basically bones and joints and everything, and that's what the specialist is. They specialize in bones and joints. Your walking, your movement, your knee, your hip bone connected to your whatever bone, and knee bone connected to this bone, and all of that stuff. So that's where that comes in at. And your feet, everything. It has something to do with your arms and your hands. It's orthopedic, broken bones. You could break your wrist. You're going to see an orthopedic. They're going to set it and cast it, and stuff. So that's where orthopedic comes in at and everything. And they do surgeries, hip replacements, knee replacements, rotator cuff replacements, and all types of things like that you might need and everything. So then that's your doctors, your main doctors, most common doctor's appointments and everything and stuff. So that's done. So then what is old dumb history and physical? And why is it spelled with a PH instead of FIS, whatever that is and everything? Well, I'll tell you. A history and physical is one of the most important medical evaluations that the doctor has to know you for you. Not this person, not your neighbor, not your cousin, not your child or nothing like that, but the history and physical for you is one of the most important things you could give your doctor is the history and physical, because this will tell it all and everything. So it helps the healthcare providers to understand your current symptoms. Why are you complaining about this, that, or all? Because now I know. And stuff. Now I can do this, that, and this for this person. Your past medical history, because it's history. That means something that happened in the past. Like you used to be asthmatic as a child, but now as an adult, you're not, and stuff like that. And why is this? You're having problems with your lungs again. It could be the asthma rearing its ugly head, or it could be something else even more dangerous and stuff. But let them find out. Family history, it runs in your family. Sickle cell runs in your family. Asperger's, what is it? Lupus, multiple sclerosis, and all these things, they run in your family sometimes and everything. And so they want to know that, because then they know that if it has these 3 symptoms and these are symptoms of lupus, then she might have it. And it runs in her family, and stuff like that. That's where that comes in at. So you see how they have to be like a detective, like you watch the Special Victims Unit and all of that stuff. You watch these little shows, CSI and different things like that, or my so-and-so got me to the ER. They're stemming off the truth. Grey's Anatomy and stuff. They're not exactly what we do and stuff. You don't want to know what I do when I'm inside the hospital, because they got the most pleasant names for you and stuff, like bitch, get my medicine. Yep, I was like, yep, I came to work so that I can get called that and stuff. I really enjoyed that name. That's my second name, my colonizer name and stuff. But I'm just saying, I told you that I wanted a ranch dressing, Kraft ranch dressing. They didn't send me this, and I had that happen to me. And I was like, oh, do you want me to leave the other 4 patients that I have and you want me to walk to Walgreens and get you some Kraft ranch dressing? Well, you sure that it might save your life? But it happens. I'm just telling you, real, recognize real. And everything. But I'm saying all of this to say that you got to give it up. You got to give it up and everything. So they want to know your family history, in the history and physical. They want to know your lifestyle and habits. Do you smoke weed? Don't you smoke weed? Do you vape? Do you not? You smoke cigarettes? You do not? And all of that stuff. They want to know your current medication. Is you on that? Tell the truth. Have you been? When the last time you took it? Yesterday. Okay. So you on that medicine? Okay. We'll see and stuff. Your allergies, and stuff. Do you have any allergies, sensitivities? Because there's a difference between allergy and sensitivity. Sensitivity means I can't eat, drink milk because it give me gas and my stomach be bubbling and stuff. So I'm allergic. No, you're not allergic. You have a sensitivity. So you might be what they call lactose, and you can't tolerate milk, which has lactose in it. So you're intolerant. You can't tolerate it. You can't deal with it. Okay. So that's where, the stuff come in at. So you can have a sensitivity, but if you had I'm allergic to this, I'm allergic to penicillin. That means that my throat closed up. I couldn't breathe. I was in a dire emergency. They was gonna have to put a tube down my throat or open up my little trachea, little hole and stuff, and to get me breathing because my throat then swelled up and swelled shut so that I can't get pass air in and out and everything and stuff. So that's another whole demon and stuff like that. But that will be called your anaphylaxis allergy, and stuff. That means that you are deadly serious about being allergic. So intolerance to it or sensitivity to it, or is it just this, and everything? You got to find out. If you ever had that stuff, the only thing I can think of is that movie, The Nutty Professor, where he took that little medicine and stuff. Eddie Murphy took that medicine, and then he turned around, his lip was like hanging way out here and stuff like that. That's an actual true allergy and a life-threatening allergy. And it can happen from latex and different things like that. And whatever the latex touches, like a patient that's allergic to latex, you go in there with a latex glove and go to start their IV, and they whole arm swell up, and you screaming, the patient screaming, everybody screaming and stuff. The kids screaming, the people in the hallway screaming, and stuff like that. That's where that comes in at. So we have to find out, what your allergies are. And your physical condition. Are you in good health? Are you in fair health? Are you in bad health? You got everything wrong with you and a couple things that you just added on today at the visit, and stuff like that. That's where that comes in at, your history and physical. And history just means the history part of a history and physical just means they want to know your basically your history medically. They want to know past illnesses and diseases like diabetes, asthma, high blood pressure, stroke, or cancer. Have you ever had any? And everything. They also want to know your surgical history. I got my tonsils out. Well, that's a past medical history. I had a hysterectomy. I had a vasectomy. That's the past medical history. I had a C-section, or something like that. That's the past surgical history on you. And they want to know it. They want to know if you had your gallbladder or your appendix taken out. These are very important. They need you. They need you. Because if you don't tell them, who gonna tell them? So guess what? They don't care either. And then you get sick and they go to the ER. They find out everything. I don't have all the machines at my doctor's office. So go to the ER, and stuff, because you don't tell me nothing anyway. So I don't think you respect me. Or, something like that and stuff. So it does happen. So also another one would be your family history. So I said medical history, surgical history of the history and physical. They want to know your family history, diseases that run in the family, like heart disease, which will be it starts off with high blood pressure. And then it turns into congestive heart failure, coronary artery disease, and all of those different things. So heart disease, cancer can run in your family. Somebody else had it. There's a chance that, you might want to get yourself checked out. That doesn't necessarily mean that you get it and stuff, but it means that you should check out and make sure you're getting your surveillance so you can find out if you got it. And if you catch it early, you have a better income too, but outcome from it and everything. And then there's diabetes and mental illness. And it's not crazy. You get a diagnosis, and crazy is not a diagnosis. Crazy is a slang for, oh, she this or she that or whatever and stuff. She crazy as a mug. Yeah, crazy in what? Is she schizophrenic? Is she bipolar? Is she schizoaffective disorder? Is she, is she? Okay. Is he? It don't matter. Is she? Is he? Is the human this or something like that? So that's the family history. It runs in the family. So you might want to watch that because you might have tendencies like that, or you might have it. Okay. And stuff. So then there's social history. This one is very important. A lot of people sleep on it, but you got to understand it because you think everybody that's at them football games and them tailgating games and all of that stuff, tailgating in the parking lot and stuff like that, you think that they all are right? And they so drunk that they fall over and knock over their little barbecue pit and all of that stuff. Yeah, is that cute? You know, or okay. But anyway, lifestyle habits that affect your health. Like smoking. That's a lifestyle habit and everything and stuff. Smoking is one. So don't sleep on it. These are your social past history and stuff, like being a smoker. And that's of anything, vape now or the marijuana and stuff, smoking, blunts and all of that stuff. It's still smoking. It's in tobacco paper. And then you got your alcohol use, you know. Yep, I got toe up. I was lit. I fell down the stairs and stuff. You see this little rhinoceros horn on my head? I hit my head like 5 times and stuff. Yeah, it's a knot. It ain't going away. Yep, I'm gonna put a tattoo on it. But yeah, and stuff. Then you got your drug use. Yeah, I used to get down, but the things of my past is the things of my past. Yes, but they might be the ones that make you stronger and make you able to fight a disease now with your new body and your new lease on life, you know, and stuff a lot better and everything and stuff. Or this was ignored things because you had a history of being on the drugs. And guess what? Drugs don't care if you sick. They just want to put more drugs in you. So they make you crave more drugs. You don't crave, I should go to the doctor and find out why I ain't got no teeth. Or I should go to the doctor and find out why my leg is hanging this way and I'm bent over and I can't straighten up, you know, and stuff like that. Yeah, that's a real thing. But also your social history consists of your diet. My diet consists of I wake up and I eat me some Cheetos with some ranch dressing and a Tahitian punch. No, make that a Coca-Cola because I need to get down and dirty and stuff and this and that. And that's my breakfast. And then also I eat that for lunch. And then for dinner, I eat 3 bags of Cheetos, flaming hot and stuff so that I get spicy diarrhea after that. And yeah, your diet and how you used to do it. Do you still diet now? Not to diet to lose weight, but to diet, your diet, meaning do you eat fried food 3 or 4 times a day? A lot of pork, a lot of this. Are you vegan? Are you know, and stuff like that, that all counts. It all matters and stuff. Exercise. Do you exercise? Yeah, I walk down to Taco Bell at least 3 times a day and stuff. So that's, you know, I'm walking down there, you know, so hey, you know, I must be healthy. I can walk. Yeah, you don't have a car. So I guess you do got to walk down there, you know, and stuff. But yeah, that's not the full thing of your walking and stuff, because if your diet is killing it and stuff, then the walking is in vain anyway. And then you got your sexual history. Yeah, you know, I don't never practice safe sex. I like to have that all natural, you know, they look clean, you know, she look clean, he look clean and stuff. So, you know, I get down, I make sure I don't mess with nobody that be stinking or nothing like that, but they look clean and stuff. I'm getting down, you know, and stuff. Yeah. They can be clean, smell absolutely delightful, and have HIV. And you just went on in because they smell clean. Can you smell HIV? Can you smell chlamydia? Can you smell gonorrhea? I'm just saying, I did on the last podcast last week on Tuesday, I did sexually transmitted infection. So I'm just saying, can you smell it? You most likely you can't. So how do you know? Yeah. So your sexual history and stuff. So those are big old things that you want to learn about. So that was the history part. And so now the physical part of the exam, that would be the doctor physically examines your body. That means they're touching you. They take that little thing and hit your knee and your leg, check for reflexes and all of that stuff. Or they're looking down in your throat, looking down in your throat, looking inside your ears, seeing if you got a lot of wax buildup, because that might turn into something bad. Listening, take a deep breath. Now let it out. And then they listening to your heart. They listening to how you pull that air in. They're actually listening to something. I know it sounds stupid and stuff, like I'm pulling it in, then I'm letting it out and stuff, but they're looking to see, is it going when you pull the air in? That means that you might have some type of asthma, or is it just going in and coming back out and stuff? That means something. So you see where I'm getting with this? They're not doing these things for nothing. They're trying to find out. They're flipping around and finding out, and stuff. And that's why they do it. So the part that was the history I told you about. Now we're doing a physical exam where they're touching you and they listen for heart sounds. That's why they're listening to your chest and taking a little stethoscope. Let me see. They're taking a little stethoscope and they're listening for certain things. They get the little stethoscope and they get on in there. I ain't pulled these out in so long. They stale. But anyway, and then they listen. You can listen to yourself if you got a stethoscope and everything, but they do that and they put it on different places and they listen. And it makes certain sounds. If they want to listen to your heart, they put it over your heart. If they want to listen to your lungs, they put it over your lungs. If they want to listen to the back end, to see how far the air is going. Is it going to your whole full lung or partially or some type of obstruction? They want to know that because they can get you some help, some that you don't even know to do. They're checking your temperature. They're checking your blood pressure. This is when a doctor is doing the physical exam. He's physically touching you, putting his hands on you or her hands on you. It don't matter what a human putting their hands on you. And they check your reflexes. They take that little thing and click and knock it on your knee and your knee pop up and stuff like that. They want to see that you got reflexes. If you don't have reflexes, something might be wrong with you and everything. They're checking your skin, see if you got good skin. Is there some what they call edema, that's swelling? That's when you're retaining fluid. You're keeping fluid that's supposed to be circulating around in your body. It's not supposed to be gathering in your ankles and giving you a whole cankle, a calf and an ankle, mixed together and stuff like that. So it's a reason behind that. And that calls for some work to be done. They might have to give you pills for that. So that's where that comes from and stuff. Then you got your, they check your stomach. They might tap on it and boom, 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 tap and stuff like that. They want to know, what's up, and is your stomach okay? Is your liver enlarged? Is this, they could tell by just tapping and, they tap it on there and pressing in on stuff. And if you scream, that hurt, and stuff, that's probably something that they need to check out, and stuff. So yeah, things like that. They also check your weight, physically check your weight. And then they look at the last time and did you have a huge gain of weight or a huge loss of weight and what you've been doing and all of that stuff. That's where that comes in at and everything. So that's your history and physical. It's a big one, but one of the most important things a doctor can do for you is a history and physical so that they can keep up with your care. That's why it's not good that everybody know your medical stuff, because they, first of all, they can't help you because they need to ask the same question that your doctor would ask you. Then second of all, you need to go to the doctor. That's the one that's getting paid. and stuff. The person that you're asking is probably not getting paid for it and stuff. So, if you ask the cousin or the niece Charlene or something like that, yeah, you can ask me, but guess what? I'm gonna send you to your doctor. And if you're really scared about it and stuff, and you ask me, I'm gonna send you to the emergency room. Because guess what? Nurse Charlene don't have an x-ray in her eye or something like that. You might need an x-ray. You might need a CT scan. I can't do that. I can't test your pee, and stuff like that. You got to go to the doctor for that. You got to go to the ER even for that and everything. So that's where that comes in. So then the other thing you got is, I think it's number 3 on my list behind me and stuff. And that's screenings. The reason why they do them. The most common health screenings, I'm gonna just run through these because I explained all the other stuff really good and stuff, but that would be a blood pressure screening. So they check this like annually, and if you have borderline high blood pressure and stuff, they might check it like every 3 months, or something like that and stuff, to make sure that it doesn't turn into high blood pressure. But they're gonna give you some things and maybe even put you on a medicine, a very low dose first. And then if that doesn't help you and you're still screaming and you still got the headaches and you still got all the things, then they might up the ante and so on and so forth. And now they're getting the EKG. They want to see if there's any problems with your heart, or is it just you and what you eat and how you live, and everything. So that's one, blood pressure. Then they might check your cholesterol. It's very important that they check your cholesterol because it monitors the fatty stuff in your body. You get too much sludge and fatty cholesterol in your body, it helps because it connects with that blood sugar and stuff, and that extra glucose from that whole cake instead of just a slice and stuff. They get together and stuff, and they talk to each other, and they build them a little knot inside your vein, and now the blood can't get to where it got to get to, and you have a stroke, which is called a brain attack. Or it goes, the blood can't get to the heart. The heart needs the blood to pump. It's the pump of your body and everything. It blocks it off. Then, hey, now you had you a little heart attack. It didn't even hurt, probably. Not that much, because you were just going crazy and you just wanted somebody to go in there and fix it, and everything. But guess what? It could have killed you and stuff. So it's a big deal. So then there's also a diabetic screening. That's why they get you to do that. Then they want you to prick your finger, and nobody wants to prick their finger because it hurts. And it's only a little tiny boop. And then you get a little blood out and stuff. And people will swear up and down, they just cut their whole hand off by doing that one little prick. So they're not going to be compliant with that. So now they got these new things where you take one little plug, it's like the size of a quarter, and they're called the Freestyle Libres or Dexacoms and stuff like that, and they're continuous glucose monitors. And if you're lucky enough or fortunate enough to have insurance for that, you could get one of those and put it on your they place them on your arm and stuff, and then you get a little monitor, or you could use your phone and it'll tell you your blood sugar without pricking your finger anymore. And then you got to just change them out every 2 weeks and everything, or every 16 days or something like that and stuff. And they're really heaven sent. But, the first one they're going to introduce you to is, let me prick your finger. And then you don't want to do it. And then you got to put the blood, take the little stick and put it inside the little machine. Then you got to take your blood and pinch your finger and then put it on there and stuff, and then get your number. And then you don't even know what the number is. Is that good or bad? It said 900. Yeah, that's bad. You did, and stuff like that. So, things like that and stuff. So that's where that comes in at. So that's why they need to check for that. They also got another one called a cancer screening and stuff. So I did history and physicals and doctor's appointments. Now we down to screenings. So they actually have a cancer screening. And that's where they check for men. They do a prostate check, to make sure, because a lot of men, they tend to get the cancer. It's more widely in their prostate area and everything. But it's other things you could check. But that's one of the main ones for them. But for women, it could be breast cancer. So they give you a yearly mammogram. And that's where they take your breast tissue and they stretch it up far and wide, and they smash it down like a little peppermint patty or something like that. And you be like, yeah, it's something in there and stuff. Like it's a little gristle in there, like you just smashed my titty. No, you smashing my breast down, and stuff like that. But that's what they do. And they looking for something. And what if something is there, and everything. So you got to make sure that you're getting those. And that's a mammogram. And they check for breast cancer. They also have a thing called the colonoscopy. And that's when they give you this stuff. And they used to call it go lightly. Yeah, nothing lightly about that. I don't know who said that. And I think it was a joke probably when they said that, go lightly. But you have fire and water shooting from your butt eventually after you drink this go lightly. How is that lightly if you got fire and a dragon lair inside your butthole shooting out hot water and poop and whatever else and stuff until you get to them, and now you all lost and turned out. But you all lost and turned out and stuff, and then they go in there with a scope and go inside your butt and stuff, and not in no sexual freaky way. They're looking for things, and it's certain things that they look for because they can indicate cancer. So it's a big deal, and it's nothing funny about it and stuff. It's actually a big deal. Also, women have a cervix and everything, so it's another thing that they go not only for the breasts for women, but they go for a pap smear, and that's when they go inside the woman's vaginal canal, cootie cat canal and stuff, and they look for the cervix, and they take a little scraping and they check it for cancer, because women tend to get cancer in that area and everything. And even more so young women, and stuff, once you're sexually active and stuff, you got to watch out, because if you are not practicing safe sex, you might get pregnant at the drop of a hat. But also if that guy has genital warts or something like that, it can literally give you cancer and stuff. It's called the human papilloma virus, and that's a cold one. And so they got a vaccine for that. So you see how some of the vaccines actually really do what they say. They're giving your immune system a chance to fight, or are they going to look stupid when you get that COVID, you get that flu, and they don't even know how to fight it because they never came across it. But if you get the flu shot, it'll fight with that little arm where it went, but now they remember. So they like, oh yeah, I remember you. Now it's a different flu coming, but they like, I fought something like you before. I'm a tear you up. But guess what? If they haven't fought it, I'm like, I'm gonna tear you up. I think, yeah, your immune system is like, yeah, I don't know how to fight that. I don't even know what it is. I've never came across it. Why is it in her? Why is it in him? Or something like that. And so they can't even fight for you and everything. So then we got a bone density. Don't sleep on this. I look at it like SpongeBob is a sponge. And have you ever seen just a basic yellow sponge? And it has all those holes. Your bone is not supposed to look like that. It's supposed to be a solid bone. If it got all these little pieces missing, guess what it makes it? Easy to break. It's a sponge, it's spongy. So it has all these places, missing items, missing little circles out of it. So do you want a house that stands on a solid foundation, or you want a porous foundation where it got all these little holes in there so it can bend and break and everything? So that's where that comes in at and everything. So it's called osteoporosis, a porous bone, which is not a good bone and everything. So they do a bone density test, and those are screenings and everything. So I think I'm getting down to the nitty gritty and everything. But before I go there, I want to give you some age groups. And yes, I'm talking about babies today. Yeah, they got to find out too. They don't even know what's happening. They just be crying for some milk and stuff, and then they get a shot. Oh, they pissy mad at you. But you know, that's what happens and stuff. So infants and children, they're at high risk for ear infections, asthma, and RSV, respiratory syncytial virus. Also, developmental delays and vaccine preventable illnesses like measles, mumps, chickenpox, what is it, rubella, whooping cough, and all of that stuff. So it's important that they get their vaccines as they're growing. They get growth monitoring. They got the growth chart, and they say your baby is in a so and so percentile. You know, some babies are smaller than others. Sometimes there's a preemie. They might run, you know, smaller than others for a while, and then they mess around and catch up, and then they're giants, like my grandsons. But anyway, you know, they catch up and stuff, and then they're, you know, nice, healthy, strapping young men or women, you know, and stuff like that. Little kids, baby busters, and stuff like that. And then there's also vision and hearing checks. Yeah, babies can get, you know, it's a certain kind of thing that they check for kids and children and stuff like that to see if they got vision problems. Have you ever seen those kids with the glasses, and they got the little funny glasses with the rubber thing and stuff like that? That's not a joke. They found out early. So that person might be able to live a better life and see much better as they get older, and things can get corrected better and everything. So that's where that comes in at. Then you got your teens and young adults. They're at high risk for mental health disorders or mental illness of sorts, bulimia, anorexia. Those are all mental health things. Depression, that low self-esteem, you know, it's mixed with something else, and it gives them depression and stuff like that. Being bullied and all of that stuff, it gives them certain mental illness. They can become suicidal. So those type of things, you know, you got to watch out for your teens and young adults, because they're very impressionable. All the people like her and stuff, so I give it up. Everybody gonna come to me, then, you know, I give it all to them and stuff. You know, that's where that come from and stuff. So they're at higher risk for sexually transmitted infections, because they're trying to give it up so that they can be popular, you know, or something like that. Mental health disorders, sports injuries, you know, playing football, basketball, tearing that ACL, football concussions, you know, different things like that. And then also substance use. They trying to drink. You ain't old enough. And whose alcohol you drinking up? They gonna kill you? No, their parent or something, unless they supplying it, you know, and stuff. He had a tight party. We was at the kickback and whatever. But anyway, so substance use, that could be drugs too, marijuana included, yes, and stuff. They're not taking it for medical marijuana. They taking it for, I'm cool when I'm vaping. I'm cool when I'm hitting this, you know, or passing a blunt. It's in rotation and stuff. And then you got your important screenings. They screen for sexual health for these teens and young adults, and depression screening, you know, and then your drug and alcohol screening. These are very important. Then you got your adults, and I'm doing it by age now and stuff. And that would be adults have a higher risk of high blood pressure, man or woman, just an adult. High blood pressure, diabetes, obesity, which means overweight, over your what's normal for you and everything. Yes. Thank you, Mama Rosie. She said, well, Jesus. I know. I'm almost finished, Rosie, and stuff. I'm going to just go a little bit over, because people need to know why you need to go to the doctor. That's the whole reason for this. That's supposed to be the doctor. Don't fault me, fault. No, I'm just like, I'm just kidding. But yeah, he's like, I only got 15 minutes for you and stuff. And you tell him 115 minutes worth of stuff. And guess what? Now he behind, or she behind, or it's behind and stuff. So that's where that comes in at and stuff. And then for the adults, they, you know, is stress related illness, obesity, diabetes, and high blood pressure. And so it's important to get monitored or screened for cholesterol screening, weight screening, weight gain or loss and stuff, and how you doing with it. Blood sugar to check for diabetes, because it'll come back to haunt you. Heart health, and that's to keep you from having a heart attack or stroke or both, and everything. And then older adults, so they're at higher risk for falls, dementia. That's Alzheimer's. No, Alzheimer's is Alzheimer's, and dementia acts like Alzheimer's, if that makes sense. And then there's strokes, heart disease, cancer, and medication complications. They taking the wrong medicine. They took too much of the medicine. They don't remember if they took their medicine, so they take it again in the same day and drop their blood pressure, and then they fall over on the floor. And then there's help. I fall in and I can't get up or something like that and stuff, all of that stuff. So the important stuff that they need to do is get a memory screening after a certain time. When you find yourself forgetting and everything, it's time to start screening and everything. Fall prevention. What can we do better? Go ahead and use that cane. Don't be scared to use your cane. Don't be scared to use that walker, and stuff. That might help you. That might save you from a fall. Bone health. You don't need SpongeBob bones and you older and stuff, and then you fall and you shatter your hip. You don't just break your hip or something like that. You shatter it. It can't even be put back together again. Now you permanently disabled and can never walk again, and stuff. Or you pass away. Yeah, it's that serious. And then medication review. Do you remember how to take it? Do we need to get the little blister packs where all your medicines for the morning is in this pack, and you pop it and it got the same date on it and stuff like that, and you get it like that? It's certain things that they could do so that they don't mess up their medicines and everything, or have somebody administer them, give them their medicine so that they know that it was taken or not taken and everything. And then what is lab work? Well, that's when you go to that routine checkup and you tell them 5 or 6 things wrong with you, and they say, I'm gonna get some blood. I'll need you to go to the lab and get you some blood drawn and everything. And they come back and they tell them something, and they can tell you that after they get the blood. And that will be your lab work will be to diagnose illnesses, to monitor a disease that you already found out you had, to detect infections, and to evaluate your organs. Is your organ shutting down? Is your kidney still kidneying? No, I'm just saying, is your kidney still helping, filter your blood and clean your blood and everything? Are you peeing? Stuff like that. They need to know and evaluate. And your heart is an organ, so they need to evaluate your heart. Your brain is an organ. They need to evaluate it. Your skin is an organ. They need to evaluate it. So you see how important that is and everything. And that's your lab work and stuff. And that's what they do that for. And it's a whole bunch of tests, hemoglobin A1C, and that's to detect how diabetical you are and stuff like that. You got some CMPs and CBCs, complete blood count, comprehensive metabolic panels and stuff. Yes, you don't know what that is, and half the time none of us know what it is until we mess around and start looking at the results. And then you find out, oh, I'm not in that range, so that means that this is bad, or that means that this is too low. I need to get this higher. This is too high. I need to get that lower and stuff. That's what that's all about. So now that you understanding, staying at home is not an option for you. I don't want to go to the doctor. They always tell you bad news. So before I end this and stuff, I just want to talk about that real quick. They wanted to send me to I didn't talk about vaccines, but that would be your flu shot and everything. But I did say something about it and stuff. But kind of for time's sake and everything and stuff, so I won't bore you to death, but I'm telling you, go to the doctor and stuff. Is because I don't want to go to the doctor. They always trying to do this, or they always telling me some bad news. Guess what happens if you have diabetes? Okay, diabetes, and you don't want to go to the doctor, but you be sweaty. You have the 3 P's of diabetes, which is polyuria. You're peeing all the time. You peeing. You can't, where all the bathrooms at Walmart, Target, wherever you go, every restaurant and everything, where to go and where the bathroom is and stuff. That's the 1 P. And then a second P of diabetes is polyphagia, which is excessive eating. I'm hungry all the time. I just can't get enough. I gotta have 3rd, 4th, 5th, 6th, 17th of the food. I eat inside the house and home. I don't know why, but so I'll just buy more food and stuff. And then there's another one called polydipsia. Those are the 3 P's that you got diabetes and everything. And polydipsia is excessive thirst. I drink water all the time. I'm drinking water now. I'm talking to you and drinking water, and all of that stuff. Yeah. You drinking gallons and you still thirsty because you got diabetes. So guess what? What you going to do? Continue to eat the way you eat. You're going to continue to sit on back. If you get a little headache or get a little dizzy, you take a little pill, take a nap, and you feel much better and stuff like that. Did that cure the diabetes? Because I want to know. Probably not, right? And stuff. So if you don't go to the doctor and find out that you have diabetes because they always giving you bad news and you don't want to know that you got diabetes, then are you making a choice to die of the complication of diabetes? Because diabetes keep on leveling up. You might have a little bit of diabetes. They call that pre-diabetes. And then you might have it a little bit more. Like, I found out I got diabetes. Okay. But guess what it don't do? It don't turn down for nothing. It says, diabetes says, turn down for what? Yeah, I'm not turning down and stuff. This is my human, and I'm about to I'm going to tear them up, and stuff like that. So the moral of that story is, if you don't go to the doctor, you will you might roll in to the emergency room, or you might be pronounced right in your living room, and everything, because it's that serious. If you don't get your blood pressure checked, because they might tell me I got high blood pressure. Well, why be scared of it? Because you could actually do something about it and then live longer. Or you could suffer and sit at home with pounding migraines, feeling like you got a tumor in your head or something like that, and that your skull is bleeding, and it's just high blood pressure. And they can give you something for that. And you could change your diet, and then you can live to fight another day. So when I say this, the whole reason for this podcast tonight was to just inform you that that's what happens when you got the package and you don't even go get it checked out. Aside from the fact that if you don't get it checked out, it could be a sexually thing, sexual transmitted infection or something. Just because you got syphilis, just because you got, gonorrhea or whatever and stuff like that, guess what? They dare to trash your system. They did it. They messed around, effed around, and found out that's the real F word, not faith and stuff. When you get on down and stuff, and you get one of these infections and stuff like that. So guess what? Just because you're silent about it and you ain't gonna even have sex no more, yeah, it's still in you. So guess what? If you don't get it fixed or you don't go take that medicine, yeah, it find other ways to level up on you. It might make your eyeball pop out. It might make your eyebrow fall off, your ear fall off or something, but it's going to make something happen. You might lose all your hair, or something like that, down there and up there, all of it, under your underarms or something like that. But you're going to find out that something's going to happen. And wouldn't you rather catch it early enough that you might be able to do something about it, or you just gonna live with it and let it eat away at your brain like syphilis can do? It'll stop messing with you. You'll stop itching and burning and stuff, and be like, "Yep, she gonna find out. Yep, he gonna find out," or something like that. But that's the real deal. So now I'm gonna go ahead and finish my conclusion. That was my rant and stuff. But now I'm gonna finish my conclusion, and I'm just gonna go to the actual conclusion, and that is, many people wait until their body completely breaks down before seeking help. Didn't I just talk about that? Unfortunately, by the time severe symptoms appear, disease may already be advanced. A routine appointment today may prevent an ICU stay tomorrow. You hear that right now? I got to say that one more time. A routine appointment today may prevent an ICU stay tomorrow. A simple blood test may uncover a hidden diabetes. A mammogram may detect cancer early, and you get to live, not die. A blood pressure check may prevent a stroke or a heart attack. A vaccine may prevent hospitalization, or you could die from measles, chicken pox, or something like that. The flu. Yeah, they not playing. The flu is the flu. Why you think we don't have hardly no polio and smallpox? Because they had a vaccine for it. Okay. And what if them people all said, I ain't taking that and stuff? The government trying to put this. Yeah. Okay. We're going to talk about that too and stuff at another time. A conversation with a healthcare provider may save a life. Never underestimate small warnings, small snitching, because your body is a snitch. Your body speaks through pain, fatigue, that's being extra tired, swelling, that's your edema or other things, swelling, knee swelling or something like that. It could be arthritis, fever, weight changes, either weight gain or weight loss, mood changes, either happy or sad or suicidal or a killer, an anger killer, breathing problems, not being able to breathe, or I breathe okay, but I still feel like I'm gonna die, like somebody put a pillow over my head, over my face. Abnormal lab work. Okay, you went all the way and let them prick you with that long needle, and you got all of your little tubes of blood, nice and red, black or blue or whatever color come out and stuff. Don't you want to know what it is? Okay. The question is, are we listening? Our body's a snitch. Believe it. Thank you guys for getting on and choosing you and choosing your life and your body and your health and everything, and doing all the right things to get through with life. Auntie Josie said, good information as always. Thank you for educating us. Well, thank you for sitting still for me to educate you. I'm not on here playing. I promise you guys. I try to be interested. I try to make little cartoony things and stuff like that and everything. But this is dead serious. It's a matter of life or death. And I wouldn't be on here, and stuff. How many are doing it like me? How many are doing what I'm doing? I'm in some of you guys' living room because I know you, your family and everything and stuff. And I'm in some of you don't know me from anybody else and everything. But I chose as a registered nurse, but somebody in the healthcare field my entire life. But the past 34 years now and stuff, being in the healthcare field, being all types of different things, medical assistant, medical office manager, certified phlebotomist, certified EKG technician, registered nurse, certified nurse's aide, medical assistant, what else? Mother, daughter of mother that got sick. And I had to find out everything I needed to do for my mother, and everything. What else have I did? A lot. It doesn't matter. It's a lot and everything. But I'm saying this to say that I'm not just a okie doke or around the way girl, you know, and stuff. I didn't been there. I didn't touch stuff. I didn't seen stuff that I will never be able to erase out of my brain. If I have full-fledged dementia, I'll still remember that patient or that situation or something like that. This is nothing to play about. Hospice visiting nurse. I've been so many different things, and I've touched so many different areas of life and dealing with it and looking at every single thing. And I'm just not on here to play. I'm not on here. Yes, ma'am. Huh? What? Oh. Oh, okay. Look, I'm like, oh, that's second in command. I'm first in command. That's second in command. She said, oh, and make sure you guys, you can watch the live. It'll be on 3 minutes, 3 to 5 minutes after I get off live. I'm on live right now and everything. For those of you that didn't get a chance to get on, I thank you for trying. I will work with you on that and stuff. I've already gotten a text and stuff, and I seen it, Mrs. J. And definitely I'll be working with you on how to get you on and everything and stuff. So no worries about it. You'll be able to watch the not live version, but you'll be able to see what I said about these different things. This is very important. And when I pick a subject, it's because there's a need that needs to be fed. And one is why I got to go to the doctor. I could just take some Tylenol. Tylenol doesn't heal you. Alka-Seltzer doesn't heal you. Pepto-Bismol doesn't heal you. Robitussin doesn't heal you. Vicks doesn't heal you. What heals you is finding out what you got, working with somebody that's educated and went to school and got the degrees to show the proof of this and stuff, for that person to be talking to you, that knows your history, that doesn't have to play Columbo or one of these Sherlock Holmes to get the information out of you, that you're able to just go ahead and give it to them, because they can teach you how to at least increase the quality of life. You don't want to be bent over and cripped over and stuff and have a poor quality of life. Let's leave this place in at least some type of good situation. Because bad is bad, and it gets worse, and it adds on things, mental illness and all of that stuff. Once you so far gone, all the other stuff checks in and stuff. So this is very important, you guys. And like I said, I take my time out to do this because this is what I love to do, first of all, and because I have the gift. I have the gift. And I know I have it and stuff. It's been told to me many times before, but I know that I have it. And I talked to somebody and everything. And so he wouldn't let me learn what I've learned to just leave me. And I need to pay it forward and stuff. I need to respect people, human beings, and pay it forward. So like I said, I tell it to the doctors and the different doctor people and staff that I'm around and everything, and they got a choice to get on and everything. But at the same time, one day you're gonna see that it's gonna catch fire and it's gonna blow up. Catch me now while I'm at least a little more humble and I'm reachable, as opposed to catching me and it's too late. Now I got a whole talk show and I can't talk personally to you and everything. I don't ever want that to be the case where I can't personally talk to my family and everything and stuff like that. But just watch out, because it's coming. I already seen it. I already feel it, in my soul and stuff. So like I said, your body is a snitch. Please believe it. It's not doing it for nothing. Don't make it in vain, because one day it might stop snitching, and that's probably the day that you close your eyes, never to open them again and everything. So yes, you have just saw another installment of Medical Talk in Layman's Terms with Nurse Charlene. I thank you for sitting around listening and stuff. I know that you guys got to go and stuff. I appreciate your time and I respect your time and everything. And I'm glad that you were able to get on And anything that you might have missed or want to still ask again, you could still leave me some comments and I'll address your comments, but also go back and listen to it again. It's really important. And guess who else gonna go back and listen to it again? Bam, me. Yep. And everything. So it's not rehearsed, it's live. Okay. Y'all take care and stuff. You did well. Thank you for everybody that took time out their evening to listen to Charlene talk about this stuff. That's very important for you. So I hope it was a treat and everything. And like Rosie Granny Allen said, I love you, Mom, and stuff. She said, look at the board. Or did you say look at the broad? No, I'm just playing. She said look at the board. But no, you said look at the board. And so I just want to say that. But anyway, y'all take care and bless your hearts. All right.